This is the Health Hub Show and I'm your host Nyambura Kamau. So today I want to bring you the best out of the best, but before that nataka kuwakumbusha Dreamworks Investment Limited. They are here for you whenever you need them. When it comes to projects, when it comes to building, when it comes to architectural designs, they are your people. So leo nitakuwa nawatembeza. This is Mount Kenya Heart and Cancer Center na nataka we learn more about diabetes and how to regulate it and how to manage it. So follow me as we learn more. Welcome to Mount Kenya. As I have promised, now we are in Mount Kenya, our today's program sponsors. So karibu sana.
Asante sana.
I guess utawakumbusha tu jina safi.
Yeah. My name is George Kaho. I work here at Mount Kenya Heart and Cancer Center, whereby my work involves diagnosing heart diseases mainly, and then with my colleagues, both cardiologists and physicians, we also treat heart diseases, diabetes, and all the other diseases that can cause a heart problem.
Oh, okay. So
yes.
Whenever someone comes, they will find you.
They will find me. I'm here on a daily.
On a daily basis. So
yes.
When you umesikia anything you need from Mount Kenya, they are here for you. So today,
yes.
I have a very common,
yes,
and it's a common problem to all.
Yes.
Something we call diabetes.
Yes.
Unaweza tufafanulia vizuri diabetes ni nini and
So diabetes in layman language is that condition yenye watu wanasema kisukari. Ama niko na sukari, meaning that the blood sugar that is circulating in your bloodstream,
yes.
ama ile sukari iko kwa damu yako, iko kiwango kubwa kuliko venye inafaa. Yes, so there is a certain level or range that your blood sugar should be in. So, for example, when you wake up in the morning, yes. or what we call fasting, because normally what is advisable is that someone should sleep for at least 7 to 8 hours. So fasting, after like 8 hours,
yes.
your sugar should not be above 7.
Oh, okay.
Yes. So there is that ukidungwa, kuna kale unaweka hapo kwako ka machine and then it reads a number. So the number should not be above 7.
Above 7.
And when you walk into my office, whether you have eaten lunch or you have eaten breakfast or you have had your meal, then your sugar should not be above 11.
Above 11?
Yes.
Okay.
What we call random blood sugar, meaning we have taken it randomly. Whether you have eaten, it's not like the one we said when you wake up in the morning, or what we call fasting blood sugar. So mtu akiwa na kisukari is when those numbers are
above.
Yes, those ranges
are above.
Yes.
So is there okay, nasikianga kuna type A, type B, type C. Can you tell us?
Okay, it's type 1, mostly type 1, type 2. There is also what we call gestational, which occurs in those ladies who are pregnant. But mostly what we deal with is type 1 and type 2. Type 1 occurs in younger individuals,
okay.
whereby that sugar that is in your bloodstream, in order for it to move from the bloodstream to where it's supposed to be utilized, okay. like for me to be able to talk, I need that energy.
The energy.
Yes, to be able to walk and all that.
Yeah.
So for that sugar to move from the bloodstream into the organs, there is a specific vehicle called insulin,
okay.
that carries it from the bloodstream, inaipeleka kwa mahali nafaa kutumika.
Oh.
So in type 1, the organ ama kale ka factory kana produce your insulin gets spoiled. totally. So these guys are not able to produce insulin. Yes. So they have to be on a daily insulin injection. Yeah, but it occurs mostly in younger generation. Then type 2 occurs in the older generation, and this is whereby maybe someone mostly is obese, don't exercise, they have a family history. So what happens is that yes, you are producing that insulin. The factory most of the time is not as defective or is not defective, but that insulin is not able to take the sugar to the organs that is supposed to be utilized in. So you find that those people also have increased sugar. Yeah.
Now, when it comes to the cause of diabetes,
Yes.
okay, do they have a common cause? Like whatever causes?
Okay, mostly there is not a common cause. Okay, in type 1, we know that it predisposes in some families, and then there is some, especially, you know, when you are exposed to some environmental factors, the body fights that organ.
Oh.
Yes. So that one is there. But in type 2, again, is all about risk factors.
Risk factors.
Yes. One is age. The other one is lack of exercise, sedentary lifestyle, eating the wrong foods. Yeah, and many, many other things. So type 2, it means that we can prevent from getting to us by doing the right thing, eating the right food, exercising, and all that.
That part where we're talking about food,
Yes.
it's very special to us because that is our daily routine. I mean, we eat all the time. most of
Yes,
us.
yes, yes.
So, ni type gani ya food ina increasing the risks of getting diabetes?
Mostly it's the carbohydrate types of food, which we tend to eat a lot. We tend to eat a lot of starches in our daily meals. You find that, like for example, my plate, half of it is starch, or even 3/4 of it is starch, and then you find that I have a very small portion of vegetables and very small portion of proteins, and that is our diet and that's our habit. So when we do that for a long time, then we tend to get obese, we tend to have a big body and all that, and the process of getting type 2 diabetes starts from there. So it is a process. So it starts from a very young age. So we are supposed to start doing these things from as early as possible.
Talking of early,
Yes.
you know, some of us think maybe when it comes to diabetes, well, umesema ni starch. Na tunajua sukari ni starch. Then there is those of us, we love taking snacks, we love taking sugary things, we love taking, can it cause, is it one of the risk factors?
Yes. Those, especially those sugary things, those starches, those crepes, those cakes, those pizzas, those chips, all those nice things in quote. They are the ones which are predisposing our society to getting these types of conditions, or those types of conditions which are called lifestyle diseases. Yes, or lifestyle diseases or non-communicable diseases, mostly, especially diabetes, high blood pressure, even cancers. Yeah, so all those things, there is a big role that is played by the kind of, especially the snacking, all those, especially our snacking, because our snacking has a lot of carbohydrates.
Yes,
Yes.
that is true. And I have realized in all our sessions,
Yes.
most of them, actually not most, it's all of our sessions.
Yes.
I have discovered main causes, main problems. It's our dieting and exercising daily.
Yes.
So mashida zote basically, it's how we eat and how we keep our body, right?
Yes.
Well, nice to know now. That is I'm learning. Najaribu,
Yes.
but I have improved. Nafanya exercise.
Oh, good. Oh,
and
good.
my audience too.
Oh, good, guys.
Wanafanya exercise.
Yes.
So, one more curious question.
Yes.
It's about the symptoms, like how ni kitu itapia physically, ama how is it detected, ama do we have to go to the hospital?
Okay.
But before we get that answer,
Yes.
sitaki our audience usonge kidogo. Don't touch your remote. Don't move any single bit, because we will be back with more. And I want to remind you, beside Mount Kenya sponsoring the program, we also have DreamWorks Investment Limited. Whenever you need project management, you need architectural designs, they are here for you, and they are available anytime and wherever you are. Just give them a call. Again, I'm Nyambura Kamau.